Hello, everyone. Welcome to Managing Mental Health and T1D in 2021, hosted by the Mary and Dick Allen Diabetes Center at Hoag Hospital. We're going to be getting started in just a moment. I just want to remind everyone, we are going to be doing a Q&A session at the end of the program. So if you have any questions as they come up for you, go ahead and pop them into the Q&A box so that we can address those during that section at the end. And I also want to remind everyone that a recording of this event will be available on the Hoag Health YouTube channel. So if there's more information that you would like to go back and review, don't panic. You can definitely check that out again later on, in addition to other programming that's been made available on that channel. So let's go ahead and get started. I'm Samantha Markovitz. I am a national board certified health and wellness coach and also the supervisor of health and wellness initiatives here at the Mary and Dick Allen Diabetes Center. And we are so thrilled to be talking about this very important topic, and we couldn't have picked a more relevant time to be discussing mental health and type 1 diabetes than National Diabetes Awareness Month, which is November. So this has been such a challenging time for so many people during the pandemic, and certainly there's been a layer of additional challenge for people living with chronic illnesses like type 1 diabetes. So we're very excited to have with us this evening Dr. Jenny Marshall, a licensed clinical psychologist who has lots of experience in working with folks who live with type 1 diabetes, and I'm very excited to have her tell us a little bit more about herself. Welcome, Dr. Jenny.
Hi, thanks for having me. It's so nice to be here. I am a licensed clinical psychologist here in Orange County, and type 1s are near and dear to my heart. I am a type 1 myself, and it is my specialty as well for diabetes mental health. And I'm so happy to be here tonight to be able to speak on COVID and mental health and all the issues that have been kind of coming up in the last few years for us type 1s. And I look forward to tonight and hearing your questions as well. Are you ready to get started?
Let's do it.
All right. So tonight, the plan is we're going to discuss what is mental health, what is type 1 diabetes and mental health, how is it different from traditional mental health as we know it. It's also been exacerbated in COVID-19. What does that mean? What is the state of mental health? I also want to give you some strategies that you can take home for later. And how do you know when to get help? When do you seek out a mental health professional, and what are the signs that you may need to find professional help? So mental health, what is mental health? I think that's a really big question. It's a buzzword right now. Everybody's talking about mental health, and they look at it like, oh, is it I'm depressed or I'm anxious, instead of looking at it rather than a holistic part of who I am. And I think especially as type 1s, we have to look at it like a whole picture of who we are, because mental health is so tied to our physical health. There really is that mind-body connection. So mental health, when we're looking at it in the process of tonight, will be a holistic approach as to physical and mind-body connection. Next slide, please. This is an interesting thing. More common than you think, 1 in 5 adults experienced a mental health concern in the past year. And it's time that we start really looking at, how do we get help? What are the stigmas that are attached to mental health? For a long time, people have been resistant and reluctant to go seek out help. Why is that? And so looking at it now and realizing that 1 in 5 adults is experiencing some distress, it's time to really open up these conversations. Next slide. Again, I'm going to buzz through this one. Mental health is integral to overall wellness. We'll learn later on in the presentation that blood sugar levels are tied directly to how we're doing mentally. There's been many studies out there that have discussed that correlation. And so it's important to look not only at our physical health, but again, at our mental health. Next slide. This one, I think we're pretty much familiar with what type 1 is. Again, it's an autoimmune disorder. It's something we all most likely live with if you're tuning in tonight. So I'm going to say next slide. Again, type 1 mental health is important. Maintaining positive mental health is key in risk reduction strategy beyond glycemic control. I think when we look at it in terms of COVID, we've all had some sort of experience that has brought up a stressor in our life. And when we discuss mental health, we want to really decide, how do we look at this again holistically? And COVID has opened up kind of the can of worms. You may have been somebody that was a little bit more anxious prior to COVID, and then you got thrown into the situation that our whole world experienced, and the anxiety increased. So again, looking at mental health is a key to reducing issues surrounded with physical health, specifically blood glucose levels. Okay, next slide. This is an interesting one. Again, going to COVID-19 and type 1, levels of stress are higher than in the general population. I don't know about you guys, but as a type 1, I feel like there's always kind of a baseline of anxiety that we live with, primarily because we are constantly having to worry about daily management. Did I pack my insulin? Did I remember to throw in some glucose tabs? When's the last time I changed my sensor? I know that we've all kind of experienced these different levels of stress just related to daily care. And so when you add in the unknown of a pandemic, it's not surprising that the rates of stress in type 1s dramatically increased. Samantha, I don't know about you, if you had any experience with feeling extra stressed during COVID-19, but I know I definitely did.
I did as well. And, what I've been hearing from our patients and community members who have been showing up in our support groups and at the Herbert program for young adults and in all these places is that, these different issues that have come up specific to people with type 1 diabetes during COVID, they may have evolved over the last year or so, but they haven't gone away. And I'm really excited and interested to hear more about some of this research that I know you've noted here, and just talking a little bit about how we can kind of roll with the punches on this as this situation continues to evolve, and knowing that there's always going to be this extra layer of questions for people with type 1 diabetes as we kind of move through these next stages of the pandemic.
Yeah, absolutely. And I think another point to note on that as well is caregivers of type 1 diabetes, because people and family systems that live together with a type 1 also experienced a heightened level of stress during COVID, well, we're still in it, through the pandemic, because they were concerned about others. They were concerned about, is my sister or my brother going to get extra sick because they're a type 1? One of the studies that has recently been published discussed that 30% of parents, it's on the slide, of children with type 1 diabetes had a clinically relevant score of PTSD. That's post-traumatic stress disorder. And that basically is saying that parents are experiencing COVID as a traumatic event with their children being potentially higher risk, which is an important thing to note, that caregivers are experiencing this stress. I see it in my own home with my own kids that are constantly worried, like, should we go out? We don't want to bring this home. We don't want you to get sick. All these unknowns make it so difficult in navigating where to go with COVID-19 and stressors. So I think it's an important not to just make it solely about type 1s, but also to include the family systems and caregivers of type 1s as well.
Spouses, I'm sure, as well as parents of children, anyone who loves someone and takes any sort of caretaking role with someone who lives with type 1 diabetes, I'm sure has been affected.
Absolutely. Absolutely. Again, there's so many unknowns, and the information has been changing so dramatically, so quickly. It's hard to keep up and really know where to keep your footing is. And that just adds again to that higher level of stress, where collectively as a society, we're experiencing the stress of trauma of COVID, but rather when you add on having a chronic illness like type 1, where there are so many unknowns, it just ups the ante and makes it even more stressful for everybody involved. So next slide, please.
Before we go ahead and move on, can I just ask you like an additional add-on to the information that you were just going over?
Sure, please.
Okay. So, you talked a little bit about the collective trauma that we're all going through as a society, and then, in a different way as a diabetes community. And I'm curious, have you seen, or have your colleagues seen, how this trauma is impacting day-to-day decisions in real life for families with type 1 or individuals with type 1 specifically?
Absolutely. Again, I think as a society, we're experiencing a collective stressor with COVID, right? Things have been different for everybody, whether it be something that's related to economic stressors with job loss or job changes, working from home. These stressors are very top level, important stressors that we can all experience in some way. And when you add on the type 1, it becomes more of a trauma. If you look at it, there is, again, that traumatic episode of possibly severe sickness, death, anything that can occur, which makes it more of a trauma, which I think the type 1 community has experienced, because there is that up ante that there could be a severe illness with it. So when you look at it, I think the type 1 community, in my experience, especially in my practice and the type 1s that I work with, there's a lot of questioning of, what decisions do I make? How do I make a good decision? And looking at sort of the risk tolerance of, what am I willing to take on to move forward and still be a part of society, but at the same time, I don't want to add extra risk involved. And when you talk about that collective trauma, the type 1 community as a whole has somewhat experienced that. Every type 1 family that I've personally worked with has expressed major concern about, what do we do? How do we navigate this? What happens? What happens if we get sick? And it's really, again, upping the ante on that stress level for these families and type 1s.
Thank you.
Sure. So quickly looking at this, I think this is an important aspect when we're looking at mental health for type 1s, is that managing type 1 is not an easy job. It's a job, first off, whether you've asked for it, which most of you have not. Type 1 is a job that you have. And when we look at it in the perspective of this circle, there are many things to consider in making decisions, like, what is the kind of health insurance and healthcare that I have access to? How educated is my healthcare team on mental health and my diabetes specific to me? What is my technical competency? I know that every time I kind of move forward and they're like, there's a new update on the app, I get a little stressed out, because I'm like, oh no, is that going to change how I manage it? I know ultimately it will be better, but there's always a learning curve. So there's a technical competency that's required in managing type 1 these days, just because of how things are moving progressively faster, more technologically driven, right? So the other part is family and social supports. What kind of family support do you have? Do you live alone? Do you live with your family? Do you live with significant others? Are they educated on how to deal with diabetes? Do they know how to help you with sick management? Things that on a day-to-day basis with living, but are the people around you educated enough that you feel safe and supported? The second thing is a healthy lifestyle. Diabetes ultimately requires more attention to diet and activities, which is another layer of intensity for people to have to think about these things. Again, it moves into the point of type 1 blood glucose management is really related to all of these aspects as well. I know we focus a lot on A1C and time in range as the ultimate end all be all, but we really have to look at it kind of as a holistic circle, because there are so many aspects that contribute to good control and ultimately feeling like your mental health is supported, and also your physical health. Next slide, please. This is an interesting factor, and Samantha, I don't know if you hear about it in your support groups at all, but one of the things that I have been up against is an increase during COVID of diabetic distress. My patients are reporting much higher levels of diabetic distress, and I'm not sure, I'm assuming you probably are experiencing that as well.
Absolutely. This has been, I keep using the word challenging, but I don't know another word to, encompass what this has been like for folks in our shoes, and in the shoes of, our patients and community members. I think diabetic distress is something that some folks haven't even heard of. So I'm glad that we're going to get into that a little bit, because I think people either think like, oh, I'm totally fine with diabetes, no problems with my mental health, or they think of, people who are struggling with severe depression. And some people do, go through phases of that, but there's obviously a lot of space in between those two things, where you can have a challenge, feeling fatigued, with your care, or, maybe it's something else happens in another area of your life and it's kind of the straw that broke the camel's back. And then, all of a sudden it is about your diabetes, even though it wasn't about your diabetes, or vice versa. So in a word, yes, we're definitely hearing more about that. And I think experiencing that as well.
And I think you hit the nail on the head by pointing out that diabetic distress isn't, well, it's talked about, it could be talked about more in relationship to mental health. And it is so tied into what mental health is for diabetics. And you really said it with the exhaustion and fatigue. Diabetic distress is really characterized by just a deep sense of exhaustion. And most type 1s that I've experienced are exhausted. They're exhausted by the day-to-day management. They're exhausted by all of the physical aspects that come with it. Riding the roller coaster, I don't know about you, but I know if I'm 300 and then I crash and stack my insulin and I'm 40, I don't feel very good. And then emotionally, I get really kind of dejected, like, oh, I'm never going to get it right. How am I going to get back on track again? And those little things are like bricks building a wall that compound to this diabetic distress. And it's a huge factor in really looking at kind of the overall mental health, because one of the things that's interesting is that a lot of the symptoms of diabetic distress mirror the symptoms of anxiety and depression. And it's, again, if you look at the 3 kind of conjoint circles, we're aiming for that middle one of wellness, where we want positive mental health, we want to minimize the diabetic distress, and we want to have positive glucose and glycemic control. So, but sometimes if one of those circles gets out of whack, it's hard to know how to bring them back in together. And we don't even know necessarily how tied they are. Like, for example, you have a really crummy day at work or at school and you don't feel good, and you grab an extra cookie on the table and you're thinking, oh, I'm going to feel a little bit better. I'm going to have a little sugar. It's going to make me feel better. And then ultimately down the line, your blood sugars spike. And that's not exactly the best coping strategy for those emotional pieces that were happening and maybe the trigger as to why you initially went after the cookie to begin with. So, diabetic distress plays in a big role for maladaptive behaviors, which ultimately can lead down to poor mental health, poor glycemic control. So it's an important thing to address. One thing before we move too far away, and Samantha, I don't know how much you work with this as well, but there is a diabetic distress scale that you can ask your caregiver to administer to you. And it does help kind of define in a really Likert scale of how you're doing with actual distress. So I don't know if you're using that as well in your groups, but it's a good marker for identifying diabetic distress.
I'm glad that you mentioned that. That is something I think that also endocrinology practices are trying to incorporate more often, to kind of assess, hey, we're here to look at your A1C and the time and range and your physical health, but also like, how are you doing? And that's a way that they can assess that. Additionally, I was thinking when you were talking about the cookie kind of example, it reminded me of, how some of the coping strategies that people adopted during especially the beginning stages of the pandemic, we saw a lot of bread baking. I know I did a little baking of, other things that I enjoy. The gyms were closed. Maybe I had a routine. I met a buddy of mine that has diabetes. We used to spin 2 to 3 mornings a week, and I had this great routine, and all of a sudden we're not going to the classes, we're not seeing the friends, we're maybe not eating the same way that we normally would, maybe out of some emotion or because it's there or because something delicious that we don't normally eat is around. And I imagine that for many people that has thrown them off the routine, and it's kind of a negative feedback loop, right? Like we want to feel better. So then we do the things that everybody else is doing, but those things don't necessarily work for us. We're seeing poor results in our blood sugars. We're seeing the roller coaster, like you talked about, and then we feel bad. So then it doesn't motivate us to want to do, the things that we know help us feel better. And it can be really tough, to get back on the routine that we know is helpful. And I'm starting to hear a lot more about that from people like, okay, we're over a year into this, closer to 2 years. I want to shed some of these habits that I've developed that don't serve me. So it's very interesting kind of looking at, this diagram you have here of, mental health, glycemic control, and diabetes distress around wellness.
And I think you just said it so well, that diabetics just distress and how you have those maladaptive behaviors that aren't serving you. And then it ultimately affects your glycemic control. And it's like, well, how do we get out of these negative feedback loops where, the cookie tastes pretty good. Like I kind of want to have it and I can deal with the high afterwards. It's not that big of a deal. And we've created these habits. We've gotten out of your pattern of going to spin for 3 mornings a week. And, we have more access to stuff. And while things are technically opening up more, we may be a little bit more afraid of re-entry into our old life, especially if we've put in some maladaptive behaviors and things that just feel good, but maybe aren't working as well. And then that also kind of touches on that point of, the underlying of, I know I shouldn't have eaten the cookie. I'm feeling guilty. And now I'm angry, and I'm really angry that I'm diabetic, which can lead kind of in a slippery slope to having more of those underlying feelings of depression, anxiety. And it's, again, that snowball, like you were talking about, of just, how do we get out of this loop that's going to end up moving us forward into more positive behaviors. And I think the first step is really recognizing when and how we're doing these things. Like, why am I having that cookie? And you don't have to ask yourself that every time, but sometimes a cookie's just a cookie, but sometimes it's like, oh, I've had the worst day. Oh, it just looks so good. And then the follow through of like, oh, I feel so guilty. I had that cookie. Okay. Well, that's looking at more of the diabetic distress and the mental health around it, where we can add in through professional help some tools that are really going to get you back on track, where you can start evaluating, why am I doing this? And what can I do to make it a little bit better and make better choices for my body and for my mental health? So can I do next slide, please? This is an interesting thing that I recently came across, and it was in a nursing journal. And one of the things that I particularly found, as a personal note, I was diagnosed right in between my master's and my PhD program. And I was in clinical psychology. I was working with kids, and it was the summer before my program. I was diagnosed with type 1, really had no idea what that was, and was thrown into the lifestyle, having to obviously take shots, make changes, really start looking at everything. And it shifted my whole career into working with type 1s. I was fortunate enough to participate in a program at Children's Hospital in Los Angeles, working with adolescents, and really get involved in that community. Why I mention this is that I'm in the 10 plus years now of living with diabetes. This study that I'm going to bring up was really interesting. It broke it down into people that have been newly diagnosed. And for the sake of today, I'm going to say kind of like a year under. It also broke down to people that have had it for 10 years and less, and 10 years plus, and then seniors. And what I liked about it is it kind of looked at the different elements of how people handle type 1 in the beginning stages. Like, you think about a newly diagnosed person, you're just trying to figure out carb counting, what's going on, when to take insulin, can I eat this, can I not eat this? You're checking apps, you're kind of thinking, oh my gosh, like it's really that basic level of care for the daily management stuff. Most type 1s that I see that are newly diagnosed haven't really hit that deeper emotional piece of recognizing that this is a chronic illness, because they're still dealing with the top stuff of, how many carbs is a bagel? What should I do? The thing about this, go ahead, sorry.
Sorry, I was just making a joke. I was gonna say, are we not all trying to figure out how many carbs are in a bagel still?
Oh my God. If anybody can like chat in and tell me that, and possibly a sidecar donut, I would be grateful forever. I can't seem to get either one of those right when I do that. The second part is the less than 10 years onset. One of the interesting things that they defined in this is that people that have had it less than 10 years, and you think 10 years is a long time, that they're pretty avoidant. They're not necessarily looking at the underlying causes. There's still a lot of anger. There's still a lot of feelings around it that I don't want to deal with this. I want to push it away. I don't want to change my lifestyle. I'm not really ready to kind of accept it and look at type 1 as something that's going to be an ongoing condition. It's more of, I kind of just don't want to deal with it, right? So this affects our mental health, because if we're looking at it through that lens, you may not want to do a diabetic distress scale when you go to the endo, because you don't want to see what the results are. You know you're burned out and exhausted. I don't need a distress scale to just define that for me. So you're a little bit more resistant to stuff. Moving forward to the 10 years plus, this is when there's almost a tacit acceptance. It's like, okay, we've been doing this for 10 years. It's not going away. We're not there yet with the management where we have artificial pancreases that are, keeping us, where we just have to press a button and that's it for the rest of time. We do have to do some daily management. So it becomes more of a tacit acceptance and people become task oriented. So in terms of mental health, they're more willing to say, okay, you know what, I think maybe I need to address my anxiety. I think I maybe need to address my depression and see a mental health professional, because the distress of the diabetes isn't going away and these underlying conditions aren't either. So when you're looking at kind of where you're at on the mental health scale, I want you to kind of mentally look at how long it's been. It's not the end all be all, but it's a nice piece to have, because it allows you to sort of recognize that you're not the only one if you want to avoid it, or if you're kind of like, oh, all right, it's still here, or if you're still just trying to figure out a bagel. There's all those different aspects. One thing I do want to cue in for a second is seniors in type 1. There's not a ton of research that I've seen on this population. I think, in my opinion, it's probably because it's relatively new that type 1s are doing so well and the life expectancy has gone for so long. But some of the research that I did uncover and have found is that rates of depression in seniors is much higher. Part of that is because there's a comorbidity for other physical illnesses. So you may be dealing with diabetes, but you may also be dealing with hypertension. One example that I came across was that type 1 women tend to have more issues with incontinence. So because of that, they tend to be a little bit more socially isolated and withdrawn. You can understand why. That's not something that they want to deal with in a public setting and can be kind of embarrassing. So some of these issues around comorbidities of type 1 and when you're aging are definitely tied to mental health. If you think about it, you're not going out, you're not getting social interaction, probably kind of withdrawn and lonely, and maybe start feeling those rates of depression. Knowing this, I think one of the things you can do is be proactive with your healthcare providers, because there's not always all that information. It's usually, geared towards younger and kids, is saying, hey, I just want to make sure that you think I'm okay with depression. Do you have an inventory, or is there a resource or a support group that I can hold on to and be a part of to make sure that I'm keeping on top of these things? And acute complications, I'm just going to quickly on that. I think, especially going back to COVID, it's been really hard, thinking about oh my gosh, if I'm in DKA, I have to go to the hospital. What does that mean with COVID? How do we manage those kind of acute complications? And what does that mean moving forward with mental health? So Samantha, I don't know if there's anything you want to add kind of about seniors or anything in your experience as well.
Thank you. Absolutely. I'm so glad that you mentioned this kind of unique subset of concerns for seniors who are living with type 1 diabetes. Like you mentioned, maybe the research hasn't caught up so that we can point to exactly what's going on and how we can best serve people who are going through that stage of life. But I'd kind of like to take a second and say, if you're someone who's watching this and you are in that stage of life or you're approaching it, give yourself a little round of applause. The things that Dr. Jenny is talking about for people with type 1 diabetes, it doesn't it gets easier, but it doesn't get easier, right? Over time, like we get more used to things, but the fact that you have, continued to establish your life and achieve the things that you have, to reach this point, and to be asking these important questions about, what does my mental health mean to me now that I am, maybe not in that stage of life where I'm, in the workplace or raising a family or doing the things that you may have done, in earlier stages, which are oftentimes the stages of life that we might be hearing more about in type 1 specific mental health resources. There's a lot to celebrate there. And I want to say, like, we see you and we hear you, that there's like not enough out there to be serving your specific needs. And I know that Dr. Jenny and I have talked about, how we hope to see more in this way and brainstorm how we can support our local community as well, because everyone in every stage living with type 1 diabetes deserves to have, the dignity of care for not just their physical health, but also their mental health and well-being.
Yeah, absolutely. And you guys are definitely trailblazers. I recently met a type 1, he's in his mid 70s and he's had it for 55 years. And he was describing to me how he initially took insulin and how they had to boil everything and put it in the pot, and how different it is. Now he's on a pump and has a Dexcom, and he's like, it's so liberating having this, but it's so different from where I began. And I think, looking back on it, you guys in the senior age bracket are such trailblazers for really, again, taking care of yourselves and having that glycemic control and being, role models for the rest of us as type 1s. So you're right. And creating more research would be excellent. Next slide, please. Again, how to minimize diabetic distress and maintain positive mental health. I think, again, we're kind of taking a little bit to get here, but this is why we're all here, is recognizing, like, again, how do we decrease this diabetic distress now that we've identified that it exists? Next slide, please. To do that, I also want to take a second and define anxiety and depression. Diabetic distress is definitely related to diabetes daily management, the care, emotions surrounding diabetes. Anxiety and depression, while they relate to diabetes, can be two separate animals as well. However, the comorbidities and the collectiveness is very high. So it's important to understand kind of what all three of them are, because anxiety and depression are the two highest rates of mental health that are associated with type 1s. Anxiety, it was funny, as I was doing this slide, I was thinking, oh my gosh, how do I define anxiety? I can't do it. I'm mentally blank. And I'm like, oh, you're anxious, right? I think we all throw that word around, but recognizing when we've kind of redlined into the place where it's no longer helpful. If you think about it, anxiety is something where you're feeling nervous or restless. You have, sometimes people have an impending, like it says, sense of danger, panic, doom. Oh no, something's going to happen. The shoe's going to drop. You have increased heart rate. Some people have it where they experience it where they breathe rapidly, or they sweat, or they're trembling and shaking and have that sense of what's going to happen, fight or flight. And, it's manifests in many different ways and different levels of it. There's mild, moderate, severe. If you think about it, how do we all get to work or to school on time? A little bit of anxiety helps. You don't want to be late. You don't want the teacher yelling at you saying, no, why aren't you here? Getting a tardy slip, or having your boss say, you clocked in 5 minutes past the time. So a little bit of anxiety is good. It's when it gets to the point where it's paralyzing and you can't make a decision, or you feel like every time you turn around, it's this clenching feeling in your chest and you're never going to get it right. Those are the times when, again, it's gone into that red line and it's way beyond what the typical level anxiety that's going to get you to school is. So that's something to kind of think about in your own mind, like, do I feel like I'm having kind of anxiety where it's hitting a little bit further. Again, going back to COVID definitely exacerbated this. Every day on the news, the Today Show, every possible kind of newspaper article, there was so much about people who are excessively cleaning. And we could say to ourselves, well, I'm getting rid of the COVID germs. Yeah, you're right. But are you cleaning the same thing 25 times over? And is it excessive? I don't know. So you need to start asking yourself those questions about, when has it gone to a place where it's kind of beyond what is comfortable and it's starting to impair your daily functioning. To quick drop into depression, it's a persistent, depressed, low mood. Especially with diabetes, Samantha, we just talked about the roller coaster. It's natural for anybody to have highs and lows. It's when it's a persistent mood for several weeks and you're just feeling like this big dark cloud and you can't lift it up. That's when we need to start looking at it. One of the biggest signs of depression is looking at things you used to love doing something and now you don't. You used to be an avid tennis player and now you're kind of, Samantha, you were saying you used to spin. Is it about scheduling and COVID, or is it kind of, I just don't have the motivation anymore? It's really looking at those nuances to see where it's playing into the overall kind of characterization of these different elements, and things to kind of really recognize: feelings of worthlessness, poor concentration. The main hallmark for when you definitely need to go and seek help is if you're harming yourself, cutting, if you're having suicidal thoughts, including a plan. You definitely need to get immediate help, because that is signs that the depression is definitely needs immediate care. Something to note too, which is interesting: changes in sleep pattern. If you're sleeping too much, too little, if you're getting up really early in the morning, those can be signs of depression as well as anxiety. So I just wanted to take a second to kind of put it on a slide and define it, because I think sometimes we have the buzzwords, oh, I'm anxious, I'm depressed, but we may not know exactly what it looks like. And it's good to have that kind of baseline understanding so that we can figure out down the way, again, another lens of what kind of mental health you may or may not need and the level of care down the way. Anything you want to add that I missed, Samantha, that you can think of that you're seeing, or?
These are, oh, I'm sorry, go ahead. These are great, important things for folks to be paying attention to in themselves or people they care about. And certainly just wanting to emphasize, if you are experiencing any of the more severe symptoms, to please reach out for help. Ask someone, even if you don't know if that's the right person. Just make sure that you're not letting that go unattended to, and just knowing like people do care about you. If you feel that you're struggling and it feels like, I think what's been hard, or what I've heard people say during this time is like, gosh, this has been so hard on everyone. Like, I can't burden anybody else with what I'm going through or how I'm feeling. And it is true that there are a lot of things going on for a lot of people, but it doesn't make your concerns or your problems or the things that you're experiencing any less significant. And I know that we're going to talk a little bit more about how to seek help and, when to seek help. So I won't, put you on the spot to answer those questions right now. So if those are things that you're listening to and you're wondering, hey, maybe I do need to reach out to someone, stay tuned. We're going to be talking about that shortly.
And I think that's a really good point that you brought up too. And it can relate to both the type 1, but also type 1 caregivers, is that, you can have a tendency to minimize, oh, well, you're the one that's dealing with this, or we've got COVID and there's so much and everybody has so much on their plate. It's okay. I'm just going to push it to the side, and recognizing that your experience is just as valid as the next person. And if you need help, that it's okay to ask. And that kind of moves into, we'll talk about it down the line of, it's okay not to be okay. Especially now with COVID, there are so many elevated stress levels that we've discussed, and how it's exacerbated all sorts of these stressors in your life. It's okay to say, hey, I need some support here. I need some additional care, because we don't want you slipping into those places of deep depression or deep anxiety and having that distress creep up as well. Again, it goes back to those 3 circles to keep your mental health positive, to keep the diabetic distress as minimal as possible. And then we want to keep that glycemic control, because as type 1s, yes, it's interrelated for everybody, but as type 1s, it's very crucial to have that kind of goal point of that inner circle where it's that holistic wellness. Okay, next slide, please. This is just a kind of a quick thing, assessing mental health. Again, this is something you can do when you go to see your endocrinologist. Like if you participate in one of Samantha's groups, you can talk about it as well. Finding the different people in your support team that can help, whether it be through a physical exam. If your endos notice that your A1C or time in range has completely gone kind of haywire, is looking at, what is it? Is it something that needs just an actual technical adjustment? Or is it something that could be deeper in terms of a mental health related aspect? Again, cognitive evaluations, these can happen if you're having different aspects of, for example, hallucinations. A cognitive evaluation may help kind of determine down the line. And laboratory testing, again, can rule out if it's something more biologic. So next slide, please. This is kind of, we'll talk about it now. It's care options for mental health. Samantha, do you want me to jump into this now, or do you want me to kind of push forward and come back to it in terms of looking at the different kinds of mental health that are available?
Well, as long as we're here, maybe we could just touch on what each of these things mean. And then when you get to a place where you'd like to kind of reference back, everyone will know what you're talking about.
Perfect. Okay. So there are different levels of care that you can find. And it kind of, again, goes back to that lens that we're looking at. We're sort of building how to evaluate what care we need. First being, how long have we had it, if we're going to have that piece in, and then sort of the symptoms that we're experiencing. And again, looking at kind of the distress that we may be experiencing too. The routine outpatient care is probably the most prevalent. It's individual counseling, family counseling. It's when you go and you seek a provider and typically have a one-on-one session with them and get that feedback for whether it be direct behavioral therapy, if it's looking at more of a depth psychology perspective. It's again working one-on-one with somebody to kind of uncover and look at the different aspects that you're dealing with in your mental health. Again, so medication evaluation and management. This is an important piece. It's kind of a side note. I'm a psychologist. Many people ask me if I can prescribe medication. I can't. I didn't go to medical school. However, a psychiatrist is a person that does medication evaluation, like a nurse practitioner and an endocrinologist. They can prescribe medications if you're looking for psychiatric meds to help with some of the underlying mental health concerns and management. Some psychiatrists do talk therapy as well, but typically they tend to stick to med evaluation. A third piece is, Samantha can talk to this as well. She does support groups, but group therapy is a great way to connect with peers and individuals that are struggling with similar things that you may be encountering in your life. And group therapy is typically confidential. It's really a place that you can learn from other collective experience of how people are dealing with what you may be facing again. The interesting thing that I have encountered in COVID with group therapy, especially with adolescents, is I'm noticing you can almost put them in 2 buckets. You have the teens that are super excited to participate in group therapy. They love it. They want to be all in. They want to talk and do the activities. They tend to be the teens that participate in the JDRF. Our mentors love to go to diabetic camp and can't wait to kind of be involved in that community because it feels really safe and forgiving and people understand them. And then you have kind of the other bucket. And again, I'm being very black and white here with the team that's definitely camouflaging that they have type 1. They're not telling anybody. They don't want to have anything to do with the diabetic community or experience. And so knowing where, if we're going to look at it just from those buckets you fall, that might be a good way to evaluate if group therapy is something that you want to be participating in, because group therapy requires participation. To quickly touch on it, I'm not going to spend too much time. Structure intensive outpatient programs, they're usually called IOPs, PHPs, are for more intensive needs when you may need to be in therapy every day for a selected amount of time, and really kind of working on more severe mental health issues and more crisis management. So typically people tend to seek out the routine outpatient care versus the outpatient program. But again, your physician or your mental health provider will be able to help you ferret and navigate which one you're going to need.
I just love a very quick note here as well, and thank you for breaking down what each of those things look like. I think some of these things were available through telehealth, so like virtually on video, et cetera, prior to the pandemic. But I think what we've really seen is this trend towards telehealth and expanded access in almost all of these areas, I believe, where, maybe if there isn't someone that lives, right down the street from you or practices right down the street from you, maybe they're a little further away where it wouldn't be practical for you to be able to drive there once a week or, on a regular basis, that they may be able to take you on as a patient, or you may be able to seek out, mental health care services, online. Or if you're someone, who still feels, like, hey, I'd like to, limit my contact with other people, which is a very, understandable thing right now. A lot of people, myself included, still keeping it pretty, moderate when it comes to in-person interaction, just really wanting to protect the health and safety of our community and our type 1 community, especially. Just wanting to say that these are things that you may be able to engage in remotely. So there's lots of ways to access this type of care in each of these categories.
I'm really glad you brought up the telehealth part. I didn't mention that, and that's a huge piece. One of the gifts actually of COVID is that I think it increased dramatically the amount of practitioners willing to participate in telehealth and do Zoom sessions. And it can enable, like you said, practitioners that may not be next door, but you connect with, and you're able to see them then over telehealth and have that relationship, get what you need in your mental health, and still not have to worry about, say, maybe you found somebody you really connect with in Northern California. You don't have to go to Northern California to seek that care. And again, finding those connection points for people is more accessible, like you said, with telehealth. And that's a really good point to bring up, is that, traditionally mental health was typically done in person, and now there's much more expansion and opening for kind of flexibility. That's a really great point. Thanks for bringing it up. Next slide, please. This I'm going to kind of skip over. Again, this is the 3 different inpatient care options. If you get to that point, I think your endocrinologist or mental health care professional will go over it. But just to let you know that there are different levels of the more acute care available to people. Next slide, please. Again, this is, I think, speaking to don't hesitate to seek professional help. We're here, again, telehealth, Zoom, we're looking to help and participate. So it's asking those questions about how I get there. Next slide, please. Here we go. How to get mental help. I think, and Samantha, I want you to jump in on this, because I think this is a really important part, and you're so aware of the services that are offered through the hospital and here. One of the best ways to identify if you need help, and if you're diabetes distress or you're having deeper mental health concerns, can be your friends and family identifying and say, hey, you're kind of not yourself lately. I'm really feeling like you may need to seek some more help. They're a great way to kind of be a sounding board for what you might need. Again, being open with your doctor and medical care, it's asking for those scales like, hey, I learned about diabetes distress. Do I have it? Do I need to see somebody? And being your own advocate. I think that's also something that COVID has brought to light, is that we need to advocate, especially for ourselves as type 1s, because the medical community is so impacted that we need to be a little bit more aggressive with what our needs are, because everybody is so inundated in this field due to COVID that you tend to have to be the squeaky wheel. So it's okay. Please talk to your doctor or medical care provider about how you're doing and check in with your mental state, because it's an important piece of your diabetes care. This is another thing. There's a bunch of, and there's another slide down the way. It's kind of a sticky subject in terms of insurance companies. What I found is that most insurance companies have different healthcare benefits for mental health and behavioral health. It's really important to call your insurance company and determine exactly what your coverage is and where the providers are in your area, because each policy tends to have a different level of behavioral health. Some of them even outsource to different companies. So the more familiar you are with your insurance provider, the better equipped you are to kind of walk in and find those healthcare providers that are in network or able to do insurance reimbursements if you have to pay out of pocket first. And again, I think an important point, Samantha, you brought it up as well. Like if you're having deep suicidal thoughts, you're really severely depressed, and knowing that you're needing help, please call 911, go to your local emergency room and hospital and seek that care. People are here and wanting to help you. Anything you want?
Yeah, thank you so much. These are, really the core things to keep in mind if you are looking to get some support in your mental health. Something that comes to mind for me as well is, I think you might be touching on this, so I don't want to steal your thunder here.
No, go ahead, please.
But, I think some of these things bring up for people that, again, this image of like, someone who needs more help than I do. And there are varying levels of needing mental health support. And although we're not very good about this as a society, and I think hopefully we're starting to see this shift a little bit, like we're supposed to go in for an annual physical every year, right? Whether you're feeling good or you're feeling bad, like at least go to your doctor once a year, your primary care doctor. Yeah. And I think that's something like we can learn from in mental health care as well, which is, hey, like maybe you don't feel bad, like you don't have, something that's dragging you into see a professional, but, maybe we want to do proactive healthcare, and take care of the mind and the spirit in that way. Additionally, when it comes to insurance, I just wanted to point out that under the Affordable Care Act, all insurance policies that are considered like compliant under that law have to provide some level of behavioral or mental health. Again, that doesn't mean necessarily that it's at the level that we would like to see it or that makes it accessible to everybody, but the coverage is there. So definitely if you get, kind of thrown off, just make sure that you continue pursuing that with your insurance provider, and to know that if your insurance is unable to connect you with the person that you would like to see, or it's not accessible due to a copay being, financially difficult or whatnot, your local community may have mental health resources that are on a sliding scale or available at no cost to you, depending on your situation. Sometimes that's local universities that have students who are going through their programs to become counselors or therapists. Can also be, through a medical facility. For example, Hoag Hospital has the Center for Healthy Living. They have mental health resources available. So please don't think to yourself, oh, I don't have any money to pay for mental health care, I'm just going to go without it. That is something that there are additional resources out there. And I do want to address that it can be hard if you are struggling with your mental health to get that extra energy to advocate for yourself, to make that phone call to your insurance company, or to have to fight to get the coverage that you need, which as people with diabetes, we're all familiar with what that feels like, just being exhausted and feeling like, why is it on me as the patient? Why can't someone come to me and make this easier? I don't know how to fix that yet. If I do, I'll definitely let everyone know. But in the meanwhile, I just want to say, you're right. It's not fair. It is stressful and hard to sometimes have to be the person to access these things, especially when you're not feeling like your best self. But please enroll your friends, family, social supports, your doctor or medical team, anyone in your life that can help you continue to get that help that you're needing.
Absolutely. And I want to add to on that note is that adding a support structure, having one person that can maybe even just ferret through online the different directories and kind of cross-check them and say, here's a list of 2 or 3 people, and saying, you know what, I'm really struggling with this. Can you help me find 2 people and identify 2 people that I can call? Typically, just as a note, mental health professionals require that the actual person call. So I know that can be difficult too when you're not feeling like you want to be the one making the call. And then the person's like, oh, I'm sorry, I can't talk to you about your friend. I need to talk to your friend directly. So making it as easy as possible by asking, like, can you just find me one name, please? And mentally telling yourself, okay, I just have to make this one call. I can do this. And really knowing that it's, ultimately for your mental health. Another support system that I want to add in there too is that I think typically when we think of community support-based groups, we think of things like Alcoholics Anonymous, Narcotics Anonymous. There's also things like Depression Anonymous that are free community-based supports that provide that group intensive care with people that may be 10 years down the line dealing with depression and can offer real world, real life experiences and kind of tips and tricks for coping skills that you can find in a community setting. That's another really good resource that I think people don't really always recognize, that there are supports for depression and anxiety on a community level as well that may not cost anything. Again, because I know we don't want cost to be the prohibitive factor in seeking mental health. Next slide. This is an interesting thing that I wanted to put up there quickly. If you get turned down by a professional right now, when you make that call and you're like, oh, they're full, what can I do? Ask them for a referral. They may be able to give you kind of a quick bullet point list. One of the things I find to be really effective, going back to the insurance companies, is they will send you over an email a full list of providers within a certain mile radius that you request. So don't be afraid to cross-check that with referrals, people, because getting a list can be overwhelming of names that you don't know. Google is kind of amazing for that too. Type in the name and see what comes up. Don't be afraid to ask for a quick complimentary kind of clinical question and answer session with the psychologist too, if you can, and say, hey, have you ever seen this? What do you know about type 1s and type 1 diabetes? Because you want to have somebody that understands the whole piece of it as well for your mental health. A really great resource for type 1s and mental health is the ADA. They have a mental health directory that you can put in, and it's nationwide, and it gives you providers that are within your region that are specifically trained for diabetes mental health. It's a good place to start. And then again, kind of working backwards with the insurance companies. Another great resource that I've recently discovered is a website called Advocate. What they do is they help kind of provide you with information matching your insurance company and also benefits and providers that are taking and accepting. It's kind of a deeper search engine for therapists in the community. I know that they have resources for Los Angeles and Orange County. And I've had some really good success with people being matched with providers that they're really comfortable with. Psychology Today, again, is another big, large database of professionals that kind of dictate what their specialties are. You can see a picture, a biography, and websites, things like that. Simple Practice, again, another directory to find, I think you want to cast a wide net, especially now with COVID. It's been a little bit more difficult to find providers. So be persistent and be your own advocate, because we are out there and we do want to help. It's just, kind of being, again, that squeaky wheel. Other services that are relatively new that are accessible as well are BetterHelp.com. They provide telehealth, and I know that they have a lot of available appointments and clinicians. Same with Talkspace. Those might be something if you're feeling a little uncomfortable leaving or not ready to kind of be back inside with somebody due to COVID or for whatever reason, they might be a good opportunity to get mental health as well. So anything else you can think of?
Those are all great places to start those searches. I would say also, if you get connected with a provider and maybe it's not a fit for whatever reason, or something happens, maybe they have to go on a leave and then you have to start over again. Again, I hate to put that emphasis on the seeker to have to, go back out and seek again, but I would like to encourage folks, like, just don't give up on it. You wouldn't just be like, oh, well, I need more insulin for my diabetes, but I don't like my endo, or, my endo went on leave, so I guess I just won't go see an endo again, and just suffer. Obviously that would be deadly. That would be horrific. We would not encourage people with diabetes to do that. And I know that's kind of a strong kind of analogy there, but when it comes to your mental health, just because you can't see it doesn't mean that it's not real and that it's not important. So if you are needing to find a provider that you connect better with, or if you are in a situation where you can't see that same provider anymore, just remember, these are different resources, directories. You might even ask, a trusted friend, who's gone through similar struggles, if you have someone like that in your life, and say, hey, do you know someone, or do you recommend someone? So please just continue to seek those resources, because it's very worthwhile.
Yeah, and I think you bring up a good point too, is that one of the things, one of the silver linings of COVID, especially in relationship to mental health, is that people are talking about it more. So a little teeny piece of the stigma that may have existed prior to COVID has been taken away. So to, again, have that conversation and encourage it. And I think recognizing within yourself too, and asking yourself a few questions of like, how do I feel about mental health? Does wanting to see somebody or talk about it or see a therapist mean that I'm crazy? How do I really feel if I'm feeling like maybe I kind of want to speak to a psychiatrist about medication for my depression? How do I really feel about that? Because we may consciously or unconsciously know it, but we have biases that we've formed. And whether it be from how our family viewed mental health, you might come from a family that wants to talk about everything and they are 1000% pro mental health. It's, a big conversation at every dinner table. Or you might have a family that was really reserved and felt like mental health is not something we discuss. So, ask yourself those questions about, hey, how do I really feel about mental health? Because that's going to inform your choice too. And it's also going to help you kind of look for who to talk to. If you're from a family that may not feel like mental health is something that, not that they don't value, but it's not something that's forefront in the diabetes care, and yet you're feeling like it's really important to you, as much as you want to seek that conversation, you may want to find somebody who's a little bit more supportive initially, and then kind of use that information to relay, like, where should I go? How should I do this? So really checking in with yourself about your kind of beliefs on mental health can also, again, create another lens to inform where to make those choices of actually seeking help.
And you can definitely take this opportunity, if you're listening to this and you're thinking to yourself, you're right, maybe I wasn't brought up thinking that mental health was something that should be discussed or, addressed in a clinical setting, but maybe I want to change that. I think that's something worth addressing too, is we get to make that choice at any time that we want to shift how we see things. We want to try something new, take an experimental mindset and say, you know what? I haven't tried it. I don't know if it works. Maybe it will, maybe it won't, but I'll give it a shot. And just, remembering that if this feels intimidating or very foreign to you, that you can ease yourself into the idea and, make that choice to give it a try and see how it goes.
Yeah. And remembering, the initial session, I think I have a lot of people that are a little reserved, and it's like, well, what is it? What is it like? Well, it can be a little awkward. I think a lot of people walk in with this expectation that you're going to give your deepest, darkest secrets on that first session and say, X, Y, and Z. You might feel comfortable enough to do that, or you might kind of just want to dip your toe in and see if you connect with that person. And I think asking yourself, is this somebody that I feel like I may be able to connect with and trust and share a relationship with in this space and build on it? It doesn't have to be like full throttle first session, you're divulging everything. You can kind of take baby steps into it and see your comfort level, and recognizing that, it's a new situation, and applauding yourself for being willing to kind of take that leap and walking into the mental health space to really take care of yourself. Next slide. Oh, thank you.
Thank you all for listening to this excellent presentation by Dr. Jenny Marshall. And we are excited to be able to open the floor up for Q&A. I see we have our first question, so we'll dive right in, and I'll just encourage everyone, if you have any thoughts, questions, comments, go ahead and pop them into that Q&A box so we can make sure to address them. So our first question: when you go from a high to a lower number quickly, why do you become stressed out and delirious? So it sounds like, maybe kind of talking about that roller coaster of blood sugars, how that can lead to a roller coaster of emotions. Maybe you can explain that a little bit for us.
I'll be honest, I don't know that I can explain the endocrinology component of it. I think from a personal example, it's like you go from this one point right here, right? And you're kind of, I would assume, feeling a little dejected, high, sluggish, and then you go to that roller coaster all the way down to the bottom. And it's that feeling of you're not in control in any way. And it's, again, I think it triggers some of those places of anxiety, like, am I ever going to get it back? How am I going to do this? And also the trauma of going from a high where you're uncontrolled to a low where you're uncontrolled, where it brings on that presentation of, okay, like, I really need to take care of myself right now because I don't want to be ending up in the hospital in the ER. And I think, maybe conscious or unconscious, we experience all of those emotions going down. That fear, that's triggered, that anxiety, that's triggered, that space of the I don't know, my body's somewhat betraying me, uncomfortableness, that high and low. I can't necessarily give you the biological aspects of it, but I think psychologically, it's that, again, that roller coaster of the unknown and uncontrollable emotions that make it so exacerbated, where you're like going from the sluggish high to that fearful place of, okay, I need to really do something to keep myself from crossing into that zone where I need severe assistance.
That's definitely something that I think many of us can speak to, whether you've experienced it once or many times, having a high blood sugar that doesn't feel so good, and then having a crashing low where there is that physical sensation alongside the emotional piece that goes along with it. And I'm sure there are many interesting pieces of information about, what's actually going on in our bodies, during that fight or flight. Is it what chemicals are being released and all of that make us feel that way. So we'll maybe have to follow that up on an occasion where we have an MD to follow up that great explanation.
Answer on the biological, and I think you're right in the fight or flight aspect of it. And if you look at anxiety, so many of those physical symptoms mirror what a low looks like. So it's almost like you combine it when you stack that insulin and you're, double arrows down plummeting, that you probably have, that reaction, which is the anxiety-based reaction. And then also that physical hypoglycemic reaction as well, that kind of compounds where it feels even more heightened. Again, I can't speak to it from an actual clinical perspective. From a personal perspective, that would be how I would describe it, like that kind of that train that hits you of anxiety and like, I got to deal with this, yet I'm still sweating from being low. So
it's always something, right? So another question from our audience, and this is maybe a little bit more into that psychiatry aspect. So, maybe you can speak to it from your perspective of any knowledge you may have. How do psychotropic medications interact with insulin, or do they interact with insulin?
I don't know how, again, that's, a question for a psychiatrist. I have had reports in my practice, and I can't base this in clinical, that blood glucose can be raised by some medications. However, I don't know if that's specific to the individual. So I don't really feel comfortable, kind of giving you the medical basis of that because it's not really in my scope of practice. I don't really know how to address that.
I appreciate you saying that. I think it's important to acknowledge too that there are many specialties in the area of mental health and wellness, and that it's important for each of us as professionals in the field to stay within our scope and address what we know best, and to refer out for things that we don't, that are not in our scope. So that is a very interesting question. So I would say that's something that we would need to direct to a psychiatrist, it sounds like.
But I think that's a good point to make in the advocating, is that, ask those questions because, sometimes they may not be having the type 1 diabetes as the forefront. They may be looking solely at, maybe you're in there for anxiety or depression, and they tend to kind of maybe forget that your type 1 is bringing it to their attention and saying, will this impact my blood sugars? And how does this kind of move for me down the line? And is it going to achieve my goal of keeping me in range, but also helping my mental health state? And really, again, being that advocate for yourself with these doctors, because, they're humans too, and reminding them about the information that you're really looking for.
Another excellent point. Thank you. We have a comment that I'd love to share. I think this is a really important story. Someone from the audience shared that this is their 40th year of living with type 1 diabetes. And so first of all, like snaps, claps, round of applause. You're amazing. I am so grateful that you shared this. So it's this individual's 40th year of living with type 1, and they can honestly say never once had they experienced depression or anxiety. Then when COVID hit, they had such an overwhelming feeling of doom, and it lasted about 4 months. They couldn't stay home because they're a nurse. So thank you for being out on the front lines and taking care of our community. That must have been very challenging. They said they were frightened to go to work every day. But once there was more to learn about COVID, they started feeling better. So that educating and self-advocacy, it sounds like. And looking back, since they hadn't ever experienced that before, they didn't recognize that maybe that would have been a good time to seek, mental health care, counseling, therapy. And so, in retrospect and listening to this presentation, they're commenting, oh, now I know that would have been a good time. And I would even venture to say, and Dr. Jenny, please, back me up or refute my point if necessary. But I would say it's not too late, having gone through that trauma as a nurse, especially, and a person with type 1 diabetes, and, having experienced that complicated, response emotionally, that it would definitely still be prime time to go chat with somebody about that. What do you say?
Absolutely. And I think that kind of goes back to sort of the beginning with that, looking at it from the lens of PTSD. You were a frontline worker, and you were out there as a type 1 where the information was so limited and so unknown, and you didn't have the choice and the luxury of doing the lockdown, stay at home. You were on the front lines, and that's a really traumatic event. And, we want to make sure that down the line that doesn't get re-triggered in a way, and that you have a place and a voice for it, and to really kind of give it some air to breathe, all of that experience that you had within you, because, that was a really, really big traumatic event for you. And, it's impressive that you were able to really kind of walk through it. But I would definitely recommend, finding a voice for it as well.
Thank you. Another audience member asks, can fluctuating numbers mimic bipolar disorder? Any comments on that?
Again, I don't have any data points to kind of speak to that directly. Specifically to bipolar, there is a lot of data to definitely correlate blood glucose levels to mood and to emotional state, sort of what we were talking about in those wellness circles. Specific to bipolar, I think you would want to speak to a psychiatrist or even your endocrinologist to see if there's any data that would confirm that. I know with bipolar, typically there's a med regime as well. So again, that's something that you want to be specific with your provider with.
I think what you mentioned about the mood swing piece, definitely, that there's data to suggest that, fluctuating blood glucose numbers certainly, can cause us to not feel well, both physically and emotionally, and anything beyond that, definitely something to speak specifically with your provider about so they can give you more distinct, individualized guidance.
Yeah, absolutely. And you think about it, you ask anyone in my family, my husband, my kids, that if I'm high and they ask me if my blood sugars are high, I tend to be a little bit of a shorter fuse, and they lovingly refer to it as walking through a buzzsaw because I can be a little snappy. So, it definitely impacts your mood, blood glucose, and there's tons of data to support that. So again, like you were saying, please speak to your healthcare provider about it, because you want to make sure that the way you're taking care of yourself is the best way possible for both your mental health and your physical health.
Absolutely. Oh my gosh, I love this question so much. So thoughtful, whoever asked this. What can friends and family members do to help when a loved one is having a roller coaster of highs and lows?
That's a tough one. Samantha, do you have anything that you have encountered that has been working before I jump in?
Well, I can definitely say, just from my own experience, it's not necessarily based on any, published research or anything like that. But first of all, I know just from talking to friends with diabetes and then listening to people, professionally, who live with diabetes and their experiences, it can be a little different for everyone. Some people don't want the help, they want to handle it on their own. And we can debate the merits of whether that's an effective strategy or not. That's not what, this question's really about. But other people really appreciate knowing like, hey, I'm not alone, and my friend or family member who doesn't have diabetes just cares about me and wants to try to learn and understand. So I would say, when in doubt, ask. But maybe a good time to ask is maybe when that person's not experiencing, a fluctuation. Yeah. A fluctuation that is impacting their mood, because that might impact their response to you. I've certainly said or done things that I regretted or didn't mean, when my blood sugar was high or low. And, I try to apologize for that and try to do what I can to, reel that in, because I do appreciate that support. And I want my loved ones to know that I appreciate that, when I'm low, maybe it's just, can I get you something? Do you need a juice box? Whatever, maybe it's really low key like that, or it's just them keeping an eye on you if things are a little scary. If your blood sugar is high, maybe it's do you want to go lay down, or just trying to kind of like gently suggest something that might be helpful. I think what gets hard is when people with diabetes feel like someone's telling them what they should be doing, in that kind of response. That reflex is kind of like, you don't know, like, what do you know? Why are I'm not going to listen to you. And that might not be polite or helpful, especially when someone's trying to do the right thing. But there's certainly different things that can kind of fit with people's personalities, and just letting them know that you're there for them, I think, is really like the most helpful thing. But what about you? What do you think?
Absolutely. Well, I like how you brought it to really like the centered on the actual like highs and lows. Like, I probably not the best time to approach is when someone's 300 or if they're 40. But I think if we pull it back to more of a drone level and look at it, there's lots of different studies that have kind of defined engagement levels for how people are in the burnout phase. Like, are they extremely exhausted? Are they engaged in their care? Are they disengaged in their care? Are we having acute complications like DKA? And maybe if you're a caregiver of a type 1 and you're starting to kind of look at the theme and the pattern overarching, you want to kind of maybe mentally take note of, hey, I've noticed over the last month, like there's really been a kind of disengagement of diabetes care. We're not looking at the daily management. And it seems like the exhaustion level, and not just physical exhaustion, but emotional exhaustion from the daily management has kind of stepped up a little bit. And kind of having a scale of, the super engaged person over here is the one that kind of reminds me of the nurse of where she's like, I never had, or he, sorry, had any real problems with it until COVID-19. So they seemed really engaged in their care and finding those support structures versus the person that might be hospitalized with DKA where there hasn't been a lot of attention given to it, and kind of looking in between at that spectrum of engaged care to disengaged to just straight, I'm not taking care of myself at all, and kind of having that gradient spectrum so you can sort of track it. Because I think as a type 1, I know for myself, sometimes I lose track of, because I'm so focused on the daily management, what the overarching theme is. And we have so much data now with the Dexcoms and the way that the pumps manifest that you can actually, kind of see the actual numbers. But it's nice to have that mental health perspective of like, I'm noticing that like 90% of the time you're so crabby and you're also really high, kind of looking at those themes, because it may be something that you can bring in and present to a provider that is either a mental health person or an endo and say, what do you think about this? How do we need to find care to address these issues on a bigger level? When you start looking at the engagement pieces, I think it just adds extra data for people. So to kind of take it back from, your day-to-day, moving back to more of a theme of mental health.
Thank you for underlining that. I think that I would just love to put the cap on it of, thanks for asking that, like on behalf of the person that you care about with type 1 diabetes. Like, I'd just like to thank you. And, shout out to the people in my life, who do that for me too. We appreciate each and every one of you.
Even though we may not say it in the moment.
Absolutely.
It may be after we're 4 lollipops in and 30 minutes of rest and back to ourselves. But yeah, I think you're absolutely right in that too, is, thanking for all the caregivers. And we know that you experience burnout too. It's hard.
It's hard to be the person with diabetes, and it's hard to be the person watching on the outside who can't feel what you're feeling and can't necessarily, always know what to do. But the fact that you care and that you're trying is really something.
Yeah. And holding that helplessness of like, I can't carry your water. I can't even give you a vacation. Like, Samantha, I would take your diabetes for a week and give you a week off if I could, but I can't, and that's part of that caregiver, is that like, there's, for as much as they do and they give, there's still that helplessness of, the type 1, unfortunately, is the bottom line there. So, it's a lot for everybody in family systems and friend groups to bear.
Absolutely. And this next question is particularly relevant in just kind of the conversation of what we've all been going through as a society over the last year plus. Have you seen a significant amount of clients struggling with conversations about their personal choices with respect to COVID? So, whether someone masks or doesn't mask, gets vaccinated, doesn't, how they feel about mandates, judging if people are judging your choices or you're judging their choices, how to dialogue with family, friends, or even strangers.
Yeah, that's a great question. It's so sticky. I think COVID has polarized so many people's belief systems around it. And again, I think, actually somebody had recently asked me, like, is it safe and should I go to this wedding? And it's kind of, again, looking at it from that risk management standpoint of, I'm like, so my first question is how well do you know the person getting married? Is it like your best friend in the whole wide world and you would miss it if you didn't go? Or is it a 12th cousin removed that you met once when you were 4 and you have no recollection of them? Like, I think, when we start peeling it apart and looking at what our personal preferences are and what's important to us, we start making decisions a little bit differently. And it's, again, those hard conversations and asking those hard questions of, vaccinations are really important to me, and I'm not going to feel comfortable in a small space with you if you're not vaccinated. So I may just have to rip the Band-Aid off and say, hey, are you vaccinated? And then trust that I'm going to be able to stand on my own 2 feet and support whatever the answer is, and say, gulp, okay, I don't think I can have lunch with you, or you know what, this is important enough for me that I'm going to, take the leap and have lunch with you. And I say that on the broader spectrum of, again, it's all those questions of defining who we are. And COVID has asked many of those hard questions for us of, what do we really believe in? What is true and holding to me? And where do I draw the line for what is okay for me? And some of those questions are really sticky. So, I think, again, it's defining your own checklist of what you believe in, and then holding to that when you start addressing these with other people, because it makes it a little easier to know where you're coming from. We can't necessarily define what the other person is going to do or say. We can't dictate their experience, but we can understand our own position and make decisions with that information.
Thank you. I think that's something, regardless of how you feel about all of those things that were kind of the examples in that, I think we can all agree that this has been a difficult time. Everyone does have, different risk tolerance, different feelings about or opinions about, these topics. And so it's something that we all have to kind of grapple with and figure out how we're going to navigate. We are running really short on time, so I'm going to try to rapid fire these. Okay, we got 2 more really fast. So this person says, what are the steps to improve mental health and anxiety after contacting a psychologist? Can you please share an example of the first step to better mental health? So maybe we can distill that into, what is one action that someone can take to improve their mental health?
Absolutely. And I think the first step is, you kind of answered it in your own question of, like, once we contact that person and that mental health provider we've established that we think can help them, is, what the biggest thing you can do is show up, make an appointment, show up to that first one, and kind of see what happens. See if you connect with them, if that relationship is built. And most mental health providers, they're really, they're there to help. They're there to talk you through it and walk you through what they believe to be the next kind of phase and treatment goals. Everybody works a little bit differently, but for the most part, everybody will define a treatment plan, a treatment goal, and give you solid things based on what you're experiencing to really put concrete and tangible steps in to help you. So it's okay. I think, again, the biggest thing I can say is, like, do yourself the gift of showing up. I think a lot of times we book appointments or we contact somebody and then it's kind of like, I think I'm going to back off. I did that. I'm not, that's good enough. But, take that extra push and say, okay, I'm going to make the commitment to myself to make an appointment and show up and see what happens. And I think a lot of times people are surprised at how welcoming and warm and how good it feels to actually give a voice to some of the feelings and everything that's been bubbling up inside of you, and give it a place to be held. So again, my biggest suggestion is just make a plan and show up.
Love that. Just decide you're going to take that. The first step is deciding you're going to take a first step. Sometimes that's enough to get us going and start that momentum. All right, really quickly, our last question, and I'm not sure if this is something that falls under a psychologist or psychiatrist scope, so you can let us know. Why do I not remember most of what I have done and said after my blood sugar comes down from a high?
I don't know that I can define that in, that might be a good question for your endocrinologist or a psychiatrist with sort of, kind of the brain chemistry of what happens biologically with a hypoglycemic episode. I wish I had a more educated answer to give you, but I don't necessarily know the answer to that. I would guess maybe, it's from a psych perspective, it's a traumatic experience. Again, every time we go really low, it's kind of breaking down to that point of like near death, right? We know that if we've gone really low, we may not come back from it, or we may go into a coma. So it's really hard to come back from those places. And it's emotionally draining. It's pulling all of that reserves from you. I don't know what the brain chemistry of it is, but it's a lot to process for a person to constantly have that anxiety about being that low and then going that low and having to come back and forth on a daily basis, or however frequently you're low. It's exhausting. And that speaks again to like managing the distress, the burnout, all of those factors. If you're really experiencing like a severe emotional rebound from lows, to discuss that with a provider, because it's important information.
Your endocrinologist is a great person to talk about anything that you're experiencing during episodes of high blood sugar or low blood sugar. And remember that your endocrinologist and your mental health care provider are both part of your overall medical and care team, and they want to see you thrive. So definitely let them know what's going on with you so they can help. And I would love to thank Dr. Jenny Marshall for joining us this evening. Thank you so much for bringing your expertise and your insights on mental health and type 1 diabetes and this wild experience we've all had, as people with diabetes throughout the pandemic. So thank you very much to you. And thank you everyone who joined us in the audience. Thank you to everyone who brought in their excellent questions, great conversations to have. Just a really quick note. Again, if you enjoyed the information or found it helpful and you'd like to review it, this video will be available on the Hoag Health YouTube channel, in addition to other Mary and Dick Allen Diabetes Center programs that are also living in that space. And as you can see here on the slide, you can register for future events and programs, including our type 1 diabetes virtual support groups at hoag.org/diabetes-events. And if you have any questions for myself or the Diabetes Center, you can email me at diabetescare@hoag.org. And if you have any questions for Dr. Jenny, you can email her at info@drjennyphd.com. We hope that you all take very excellent care of yourselves, prioritize your well-being, and we look forward to seeing you next time. Thank you so much.
Thank you. Thanks, guys, for listening.